Hi, I'm Dr Amy Talbot. I'm the director and founder of the Talbot Centre, a multidisciplinary mental health practice that's located in Sydney's northwest. Prior to establishing the Talbot Centre, I had worked in the private sector for a number of years and had some amazing opportunities to learn from patients and their experiences of seeking mental health services, of their experiences of their recovery journey, and those experiences that I had with patients who openly shared with me led me to start thinking about the importance of how we might develop services that blend the best of what is on offer in the public sector with the best of what can be on offer in the private sector. And so I wanted to establish a service that would achieve this blending of the two types of services into a centre of excellence for outpatient care in a private setting. Some of the things that I learnt from patients, so part of my background is in working with individuals who are experiencing eating disorders and disordered eating, is that they would tell me about the experiences that they had. They would work really hard towards their recovery, and what they would find is that as they started to develop a better sense of their healthy self, the self that wasn't as influenced by their eating disorder thoughts and their eating disorder voice, they would go back into their community, whether it was their family or their workplace or other places that they were regularly engaged with, and they would hear their eating disorder voice spoken aloud amongst their community. So they would sit in the lunchroom and hear from other people about their diet, about their exercise routine, and they would come and say to me, Amy, it's really hard to stay well, it's really hard to maintain my goals towards recovery when everybody else seems to be thinking the way my eating disorder thinks, and I'm hearing that on a regular basis from the people in my community. I also heard stories from my other background is in working with tic disorders and body focused repetitive disorders, and I heard people speaking about their difficulties with accessing services, that there weren't easily accessible services, that other professionals, when they first disclosed, there was so much stigma that they either didn't want to tell anyone, or that they had very negative experiences of their disclosure to a first health professional, and that health professional either didn't have a good understanding of their condition and their experience, or didn't know where to send them or how to support them to get appropriate care. And so after having a large number of these experiences with a wide variety of people that I worked with, I also started to think about the importance of the role of psychologists in preventative health and community-wide education, in addition to offering intervention services. So as psychologists, we can spend quite a bit of time providing interventions and supporting individuals one-on-one or in group settings, but we don't always spend the same amount of time in the prevention space, ensuring that people are well informed, can access appropriate services, and know what the pathways are to achieve that, and that the community that they live in actually supports mental well-being and recovery rather than enhancing the difficulties on that recovery journey or reinforcing unhelpful beliefs. And what's really exciting is that the Talbot Centre is going to be moving into offering more services in the preventative and community education space in 2020, in addition to the intervention services that we currently offer. And so here's my invitation to you. If you are a senior clinical psychologist who is passionate about providing high quality evidence-based clinical services and who has a strong belief that psychologists have a unique role to play in advocacy and community-wide education and change in order to reduce mental health stigma and facilitate mental well-being, mental health, behavioural health, rather than just a reduction of symptoms, then we have an opportunity for you to join our team. We would love to chat about how you might be able to fill a role that will contribute to this vision and the work that we're going to be doing moving forward into 2020. Some of the things that might be involved in that role are taking a leadership position within the practice, where you would be working with, supervising, developing early career psychologists and students, and also holding a complex caseload of individuals with more kind of chronic or moderate to severe level mental health issues, as well as contributing to our preventative and education efforts as well. The great thing about this role is also that there's a relatively wide variety of work tasks, and the role can certainly be tailored to best match your interests. We're also really looking for someone who can bring a passion and expertise for a particular area of work that you have been growing yourself in and developing your skills in over a number of years. That could be in a similar area to me, so in eating disorders, feeding disorders, or obsessive compulsive and related disorders, or it could be in other areas that would add something new to the team and the offerings that we have for our community. So if this sounds like the kind of role or organisation that you might like to contribute to, the kind of vision that you might have for your role as a psychologist, then we would love to hear from you. Please feel free to get in touch for a confidential discussion or apply via the link connected to this ad. We look forward to hearing from you.